This is our news, the weekend edition. And on the broadcast tonight, nearly $1 million in drugs confiscated as a result of an op-ed operation in the southern Bahamas. Plus, the health minister issues a warning on the hospital's capacity. And later on, hear what a former opposition leader has to say on government's handling of the pandemic.
Our news is brought to you by Alive.
Good evening, everyone. I'm Andrew Knowles, and thanks so much for joining us. A joint operation by OPBAT yielding a significant drug seizure worth nearly $1 million yesterday. A Royal Bahamas Police Force boat carrying more than 800 pounds of confiscated drugs arrived at the Marine Unit in downtown Nassau last night. One by one, officers unloaded more than 50 sacks of suspected marijuana with a street value of $815,000. Drug Enforcement Unit officers, along with the U.S. Coast Guard, Drug Enforcement Administration, the Royal Bahamas Defense Force, and the Marine Division, mounted the operation in the Ragged Island chain based on intelligence.
A surveillance was conducted in the area of the Ragged Island chains, and the officers observed a white go-fast boat with 3 occupants, male occupants on board. As a result, the aircraft attempted to get near this vessel when they noticed that the 3 occupants abandoned the vessel in shallow waters off the Ragged Island chain.
Police Press Liaison Officer ASP Audley Peters says officers searched the vessel and recovered 55 nylon sacks of suspected marijuana. The suspects were able to evade capture, and Peters says they are following some leads.
At the same time, they also noticed that the suspects made good their escape in the wooded area where the boat was left on the shallow banks. Police are following significant leads at this time.
The Broadcasting Corporation of the Bahamas is the latest government entity to close its doors due to COVID-19 exposure. The corporation was closed today for deep cleaning and sanitization after it was brought to executive management's attention that a staff member tested positive for COVID-19. Zenith says out of an abundance of caution for staff, all necessary COVID-19 exposure procedures with respect to the corporation's headquarters are being observed. Now, normal operations are expected to resume on Monday. Well, Health Minister Renwood Wells addressing a Ministry of Health memo that revealed that healthcare workers who were previously not required to join the frontline fight against COVID would be required to do so now. Wells says it all comes down to the limited number of doctors and nurses available to deal with the second wave of the coronavirus.
This state of affairs means that the number of healthcare workers who made themselves available during the first wave of the pandemic is no longer sufficient to cover the larger volume of hospitalized patients that we see in this second wave. A real concern is the growing exposure to COVID-19 amongst professionals and patients in the healthcare facilities in the Bahamas.
Health officials announced a reconfiguration of the health system after several people contracted COVID-19 at PMH and Sandilands Rehabilitation Center. Efforts have been made, including using Breeze's Hotel to treat non-COVID-19 patients and to keep infected patients away from those that don't have the virus. Wells says the challenges the country faces aren't unique, but that doesn't mean they aren't troubling.
While the trend is consistent with COVID-19 spread worldwide in healthcare facilities, our human resource pool is not infinite, not vast. Since many of these healthcare workers were exposed and are currently in quarantine, those remaining are at a very high risk for burnout, and teams are working short of members.
Following the revelation that the Bahamas ranked near the bottom of 184 countries in the COVID-19 Recovery Index, Former Health Minister Dr. Dwayne Sands says it's now time for leaders to own the problem and decide what can be done to address it.
As leaders now, we have to own the problem and decide what we're going to do differently. This is not just about dusting off plays that may have worked before. I think we have to be creative. We have to look at new ways, different ways, so that we can get higher up on that list. We may not make it to first place, but certainly last place is not a good place to be.
The Global COVID-19 Index, published July 28th, gave the Bahamas an index of 6.99 out of 100, placing it below the countries that have made the most progress in curtailing the spread of the pandemic. The score indicates that the Bahamas is among the countries struggling to cope with the crisis and who may need to consider maintaining the stringent non-pharmaceutical measures. Sands reiterated the need for the country to improve its testing capacity.
I think that we are underperforming in terms of testing. The Bahamas now, in terms of tests per million, has just recently eclipsed Jamaica, but we're testing less than 20,000 tests per million. That is not going to cut it.
Director of the Pan American Health Organization, Dr. Carissa Etienne, says the COVID-19 pandemic is threatening the Caribbean's ability to control the transmission of infectious diseases.
We know that in some countries, infectious diseases such as dengue and malaria place a huge burden on health services. And along with many neglected tropical diseases, they have a disproportionate impact on poor and vulnerable populations, including our indigenous communities, much like COVID-19.
80% of the region has reported challenges treating HIV and tuberculosis as a result of the pandemic.
Services for common conditions like TB, HIV, and hepatitis are being affected. Over 80% of the countries in Latin America and the Caribbean are reporting challenges in the delivery of TB tuberculosis treatment. If patients skip doses or interrupt their treatment, a manageable condition can quickly turn into an active infection that threatens not only the patient, but also their family and close acquaintances.
Etienne is especially worried about HIV patients who have opted out of receiving their treatments at local healthcare facilities out of fear of contracting the COVID-19 virus due to their weakened immune systems.
We have data indicating that 30% of people living with HIV are avoiding seeking care during the pandemic. And at the same time, countries have limited supplies of antiretrovirals. This is worrisome indeed, since without continued care and consistent medications, people living with HIV are more likely to become ill and to pass on HIV to their partners.
And still ahead tonight, former opposition leader Loretta Butler Turner calls for changes in the way government is handling the pandemic. And the PLP's COVID task force co-chair weighs in on the second wave. Those stories and more coming up.
Rev up on the next promotion. Okay. Nice.
Bye. You give up it.
That's 2 out of 3.
Sign up for Rev Trio and opt in to NBA League Pass absolutely free. Visit rev.bs or call 601-8992 for details. Rev, you and us, together.
Next tonight, a former member of parliament is calling for the competent authority to implement what she thinks are some critical changes needed in the handling of the COVID-19 pandemic. Our Georgia O'Bain reports.
Former opposition leader Loretta Butler Turner is calling on the competent authority to change its approach in handling the COVID-19 pandemic. Butler Turner says she believes Prime Minister Dr. Hubert Minnis has adopted a dictatorship style of communicating with Bahamians.
There is becoming a groundswell of anger and animosity because people are feeling that the dictatorship type rulings that are being carried out by the competent authority are exactly that, taking away their civil liberties. So I believe that, if we're going to get a hold on this would be my suggestion as we move forward. First of all, there are lots and lots of Bahamians that are out of work. So we've got to have a plan.
The former F&M MP added that a comprehensive plan is needed for the economy, which she says is already on life support.
This is what the competent authority should be dealing with. Those plans to help persons economically and to ensure that national insurance is getting those checks out to those unemployed individuals and to eradicate these long, ridiculous lines that Bahamians are going on just to get canned goods that may or may not be good for their health.
Butler Turner applauded the government for offering food assistance programs to those in need, but suggested that those who have applied for food assistance be given smart cards to shop for themselves instead of being given prepackaged boxes of goods that may not fit their family's diet.
Give these people preloaded cards in the amount of money that you say that you're spending each week. Let them go to the food store. They can manage their budget better. They can select things that are going to work for their particular diet or that can work within their household, because not everybody can eat those canned goods. And there's no vegetables. We don't see any use of the BAMSI products being used in these packages that are being given away. This is a great opportunity to exploit the Bahamian farmers, fishermen.
Turner also questioned why just one person serves as the competent authority.
Enlist a group of experts. We've got PAHO, we've got Dr. Sands still out there. I'm sure Dr. Dahl Regis, if she's unable to be there, can recommend the current CMO, Dr. Brennan, turn the entire COVID over to them as a unit. And then, of course, employ all of your teachers, all of your public service people to start getting the message out into the communities, your medical team and your nurses, your doctors, to get the message into the communities so that people can understand, because this type of heavy-handed dictatorship about shut down, open up, is wearing on people's last nerves.
Reporting for our News Weekend edition, I'm Georgia Bain.
With cases continuing to rise, the PLP's COVID-19 Task Force co-chair said she believes all non-essential businesses should remain on hold until the healthcare system rebounds from the second wave. Our Jillian Gray has that report.
PLP COVID-19 Task Force co-chair Dr. Melissa Evans said though getting the economy up and running is important, the Bahamas must get a handle on the health crisis before opening up all businesses.
All unessential things that need to be done, I think we should put on hold for a while. I'm going to go out and say that. I know our economy is hurting right now. I know businesses need to function. I know that we need survival skills in place, but we just need to be really, really vigilant. If we don't have people actually going out and receiving services that are non-essential, then that's going to slow our numbers a bit and give us a chance to recoup our healthcare system so that we can open fully. And should this happen, we'll be equipped for it.
Dr. Evans said while testing has ramped up, that momentum must be sustained, as it is imperative that health professionals pinpoint where the COVID-19 positive clusters are.
We have definitely ramped up testing. I can tell you that we're above 6,000 tests, I think, in the past 2 or 3 weeks. And so it looks like some mass testing is going on. We need to continue to test because we need to know where these clusters are being formed. We need to be aware of what's out there, the numbers that are there. And we also need to know where we're being placed worldwide as far as how we're fighting the pandemic.
Dr. Evans said stopping the spread of the coronavirus takes a unified effort, adding that communities must continue to work together to fight against the virus.
More so than ever, Our fight is, we're losing this fight. We need to all jump in, hands on deck, and really, really get it done. That's really, really important. I can't express that enough. All of the complaining and I'm really, really maybe not helping out your brother or your sister or your neighbor. All of that has to stop. We all have to come in and contribute, because now this is really, really beyond us. It's really taking control, and so I must say that it's really, really important for us to put every single thing aside and really, really put forward a fight to try and see if we can do a little bit better than we're doing now. We need to improve our numbers by far.
Reporting for Our News Weekend, I'm Jillian Gray.
All right, thanks a lot, Jillian. When Our News, the weekend edition, comes back from the break, find out from a government official whether there will be any relaxed measures for fishermen.
Rev up on the next promotion? Okay. Nice.
Bite! You give up it!
Best 2 out of 3.
Sign up for Rev Trio and opt in to NBA League Pass absolutely free. Visit rev.bs or call 601-8992 for details. Rev, you and us, together.
Parliamentary Secretary in the Ministry of Agriculture and Marine Resources, Carlton Bowleg, says there are no relaxed measures in sight for fishermen who vented their frustrations last week over limited fishing hours outlined in the emergency orders.
If we want to continue not adhering to what the proper authorities are saying, then we're going to find ourselves at the end of the day keep coming back to the same thing. So I would like to see a flattening of the curve so that we can have a surge in our economy. I would like to see that.
Fishermen complained about the limited Monday, Wednesday, and Friday schedule, as well as the limited number of crew members now allowed aboard shipping vessels. However, Bowleg insisted the health and safety of Bahamians is the government's top priority.
This whole thing all depends on us. This depends on us. This depends on what we want. We got to look at health, which is, I know, the government's concern, and we got to look at the economy. And you can't look at it unless you look at both being balanced. COVID is not going anywhere, and unless we decide that we're gonna grab this bull by the horn, in so much words, and try and control this and not let this control us, we're going to be sitting in a state where safety measures are going to be put in place to make sure that our people are safe.
Up next, we take a look at the results of a COVID-19 survey, so stay with us.
Rev up on the next promotion? Okay. Nice.
Bite! You give up it!
Best 2 out of 3.
Sign up for Rev Trio and opt in to NBA League Pass absolutely free. Visit rev.bs or call 601-8992 for details. Rev, you and us, together.
Welcome back to Our News, the weekend edition. A new information company has surveyed over 2,000 Bahamians on the government's handling of the coronavirus pandemic and the aftermath of Hurricane Dorian. Intel Key co-owner Kiran Chase said the online survey found that 60% of respondents felt the handling of the coronavirus pandemic is okay, while 46% said they were satisfied with the response to Hurricane Dorian.
The most significant thing is the approval rating of the Bahamian people on the pandemic, as well as our handling of Hurricane Dorian and crisis management in general. If anyone wants to keep updated on that, we actually reassess the data every week and post it online on all of our social media handles.
The Voice of the People 2022 survey also found that 1 in every 3 people were unemployed, and 60% of that number was due to the coronavirus pandemic. Respondents were also asked about the legalization of marijuana.
And we see that 4 out of 5 Bahamians actually are in favor of legalizing marijuana for medicinal purposes, and about 3 out of every 4 are interested in the full legalization of recreational use of marijuana. So it's a lot of different things to be considered, but again, we want to make sure that we stay relevant and current based on what Bahamians are seeing and the way that they feel. So all of these things will be factored into our next decision.
Well, that's a look at stories making news this evening, but stay tuned. Our weekend weather forecast is coming right up. And that does it for us on a Saturday night. I'm Andrew Knoll. For all of us here at R News, thank you so much for watching. Let's remember to be safe and look out for each other. Have a great night.